Hello and welcome to the University of Alberta Child and Adolescent Psychiatry Grand Rounds. I'm Dr. Alice Liang, and I will be moderating today's presentation. We want to give thanks to L3, or the Office of Lifelong Learning, who provide much of the logistical and technical support for these rounds. So I will do the land acknowledgement. We acknowledge that we are on traditional territories across Canada of the many First Nations, Métis, and Inuit whose footsteps have marked these lands for centuries. So just a reminder, use the chat feature if you have a technical question. And if you have a question for the speaker, please use the Q&A feature, and you can upvote these questions as well. So I'd like to now introduce our two speakers, Dr. Andrea Yu and Dena Pedersen. So Dr. Yu is the medical director of CASA Mental Health. She is also a child and adolescent psychiatrist in CASA's trauma team, supporting the teen trauma and attachment group. And in addition to her roles at CASA, Dr. Yu is an inpatient psychiatrist at the Royal Alexandra Hospital, is an assistant clinical professor for the University of Alberta's Faculty of Medicine and Dentistry, and also serves as the AHS Clinical Department Facility Chief of Child and Adolescent Psychiatry for both the Royal Alexandra Hospital and the Glen Rose Hospital. And she is a very well-regarded CASA and AHS hybrid. So Dena Pedersen is the clinical director of CASA Mental Health. Dena joined CASA in September 2021 after spending 10 years with the St. Albert Primary Care Network, 7 of which as executive director. Dena has a master's degree in nursing from the University of Alberta with specialized clinical training as a pediatric nurse practitioner. So she has a real passion for children's mental health that began when she was a frontline nurse at the Stollery and also working in the inner city public health unit. She also continued to focus on mental health in her leadership roles within the Pediatric Weight Management Clinic, the Adolescent Mental Health Clinic at the Northeast Community Health Center, and the Edmonton Zone Primary Care Networks. She lives in St. Albert with her 2 children, Ty and Kala, and spends her free time in arenas across Alberta as an active hockey mom. So we're really happy to have the 2 of you present on CASA services today.
Thank you, Dr. Liang, for such a warm introduction. Feels really awkward to hear it being said out loud, but thank you again so much. And I'd like to start by just thanking the Grand Rounds Committee as well for having us and giving us this opportunity to share about CASA as an organization. I'm going to have Dena set up the slides, and then you'll hear from me first talking a little bit about our introduction, and then I'll go through kind of our presentation. For those of you who know me, you know I tend to speak a little bit quickly. So if there's a hand that goes up, or maybe Dena will cue me to slow down, happy to do so. And again, happy to take Q&As as we discuss. It just might take us a little moment to kind of see it come up in the chat. So while I suspect many of you already know either myself and or Dena, or know parts of our organization, what we're really appreciative of is this time and space to be able to really focus in and talk about our organization in a bigger, broader, and a succinct way. So again, for those who don't know me, I work both at CASA as well as AHS. I work in our trauma program, and I also work as an inpatient physician, and I have some wonderful opportunities doing administrative work, including my work here at CASA. Dena is my wonderful dyadic partner as our clinical director, and she knows the primary care and so much of like the managerial organizational pieces of healthcare. So it's a wonderful partnership that I really appreciate. So Dena, I'm seeing right now with the view on the screen that there's kind of like the two sides. I don't know if you can see that as well. And we can put it into screen share. Fun technological pieces. So our presentation is a very direct title, CASA Mental Health. So what I'd like to do is just begin by saying that we have no disclosures, no financial supports, no conflicts of interest. And with respect to our objectives for today, what I'll be doing, sorry, Dena, we're just going to go to the next slide. Thank you. We'll be going through CASA's mission, vision, and values, and then dovetailing that into the overview of our current CASA programs and the future directions and partnerships that we anticipate we're going to be embarking on in the future. So as a part of our evolution, you may or may not recognize that we've actually had a name change. So it's actually now CASA Mental Health, Child and Adolescent Services for All. Previously, we used to be CASA, Child and Adolescent and Family Mental Health. We dropped that last section because nobody was using it. Like people would just refer to us as CASA, but then we'd be asked questions of what does CASA stand for? And it was this piece where people within our organization, even those of us who are there for quite a long time, we were always a bit puzzled, like, what does it stand for? Does it stand for anything? And previously, historically, it used to be Child and Adolescent Services Association, but we've cleaned that up so that actually CASA does represent something as an acronym if we choose to use it that way. And that is this meaningful concept of child and adolescent services for all. We're still maintaining that family-centered health and that individual patient-centered focus, but recognizing that more in our mission, vision, and values as opposed to our name change. You'll see a logo change as well, and that's why you're seeing more colors, I think, on the screen and a different template that we're using. But we're trying to be very deliberate and clarify who we are and the foundations of who we are and what we do. So I'll go to the next slide. So with respect to the work that we're doing, I'm going to start by talking about our vision, mission, and our values. So this actually began just shy of, I think, 2 years ago, where we really had an introspective look at ourselves, and we consulted various leaders within our organization, as well as looking at external stakeholders, and then actually going and having our CEO really truly talk to the different partnerships and people that know our program or are likely ones we would partner with to really clean up and clarify what our mission and vision is, as well as our values, which is what you see on the screen now. So our vision is a community where all children, youth, and their families are provided timely mental health care and empowered to thrive. And we're working hard to be that trusted nonprofit organization, developing resilience through holistic, evidence-informed, and compassionate care, and to advocate for children and youth and families with mental illness. We were very deliberate with the wording. And again, this went through various iterations to what you see now. And ultimately, with respect to our values, we're doing this through building a team of specialized mental health professionals who are committed to delivering outcomes-based programming in collaboration with our community partners. So we're keeping the child at the center, like I said, and still being family inclusive, which includes incorporating equity, diversity, and inclusivity in a deliberate and authentic way. So now to the next slide. If it wasn't clear, because apparently it hasn't been when we've actually gone out to community and asked, we are a not-for-profit organization. I think sometimes we're mistaken because of the partnerships that we have with AHS and government affiliations, but we are officially a not-for-profit organization. And we've actually been delivering care since 1988. Clarifying our age and who we serve, we are here serving children ages 3 to 18. So we're no longer doing this generic infant title, but being very clear on there are people and individuals who work with children under 3 very well. And we want to clarify the work that we do. And we are here to focus on children and adolescents, recognizing that there's some transition work to support on both ends. As you saw in this anticipatory slide, we actually have 4 locations that we currently operate out of. So you're likely familiar with CASA Center, which is close to the university area and houses the majority of our programs. Then we have our north location at Fort Road. We have our CASA House location, as you know, as a residential program in Sherwood Park. We have our downtown office, which previously housed camp, and now, and which is where most of our back office work, I think, happens as well. And our final newest addition, our CASA West. So for those who may be familiar, it's actually close to SACE. And again, this is where we anticipate having several of our programs. So what we're going to do is I'm going to talk a little bit about how our mission, vision, and values and our locations talks the work that we do in those places. Many of you will be likely familiar with the concept of CalLocus as it's being rolled out and utilized across AHS. And we're really utilizing this to find a common language and a way to support patients and families in accessing that timely and appropriate care that we've talked about. And so CASA really sees itself as being in the middle. And I think one of the terms that our CEO uses, having been somebody who's had this lived experience, is this missing middle. The reason we talk about it as the missing middle is that we know at CASA that our primary work, like what we're really good at, is actually not about primary prevention. There are systems, there's organizations, there's family physicians, PCNs, et cetera, that are doing much better work in a much more focused way, focusing in that level 0 to 2 arena. So that is not ours to own. Similarly, we recognize that level 6 is medically managed secure placement is not ours where we excel. That is very much where AHS partners preside. And so it's not by accident that Dena knows the level 0 to 2 well, and that I'm personally involved in the level 6, so that we can focus in on our scope and what we can do well. And that's really that level 3 to 5. So we're looking at that high intensity community-based services area. And our programs that when we look at it, where we serve the missing middle, it spans the range of core, which would have been our previous school age services program, to our day programs, kind of around that level 4 area, and CASA House, which we envision as closer to that level 5 area. And then we obviously, as you again may be familiar, we have other programs as well that we provide here at CASA, and Dena will be speaking to that momentarily. So then that actually leads to our 5-year roadmap. And so it is very much meant to be strategic. So on the next slide, this is actually what we operate out of from a CASA perspective. This is not for you to have to read in high levels of detail, but it gives us in our organization a blueprint on what we're working to achieve and headlines, as we like to call them. So in high level ways, we're looking that by 2029, we want to be leaders in delivering child-centered, family-inclusive mental health services. So making sure that we have safe, diverse, and inclusive workplace, and working towards being a nationally recognized learning and teaching organization. Another big headline is looking at how we are looking at our programming efficacy and relevance, so that we're providing safe and culturally sensitive mental health services, that we are the model organization in delivering trauma-informed wraparound mental health programming for children and families. And also as a huge component, looking at our financial health, so that we have financial stability through diverse funding sources and nationally identifiable and trusted as an organization. We will be providing these slides to you after the presentation. But again, just wanting to highlight that we actually have our blueprint on how we operate. So one of the, I think, key components along with that roadmap are some key concepts that we're working towards. And one of them is doubling the number of kids. So when we talk about expanding our services, it's very much about how do we make it more efficient within the facilities that we currently occupy? How do we build and expand virtual services, certainly again with the learnings that we've had through COVID? And how are we working with partners to bring mental health services closer to kids by offering programming in other organizations and facilities and spaces? So the intention is not about building brand new shiny buildings so much as let's take what we know, let's work with the partnerships that we have and really build on our efficiencies and really work on our partnerships. And then I believe I'm handing it over to Dena.
Thanks, Andrea. And again, thank you very much for having us speak today. So I'm going to just go through an overview of our clinical programs and services. We've put our programs and services into 5 categories just for ease of understanding and flow when having conversations with various stakeholders. Our current 5 areas that we really focus in on are core. So again, a program that's an amalgamation of some of our historical programs. Our specialty services that are really focused on treating specific areas or specific concerns, our day and residential programs that are very much more targeted at a higher complexity, more intense support for the patients and matches their needs, as well as we have assessment and treatment supports that help our teams in developing their diagnoses and as well as implementing their treatment plans, and consultative services that are external. So you can find all of this information on our newly revised website that will provide information on each of these programs, but I will take you really quickly through them. So to start with our core program, core program is really focused on supporting our children and youth ages 3 to 17 or 3 to 18. And the intent is it's a combination of what was our historical school age and infant and preschool services. The program is really focused on supporting children with a wide range of mental health concerns and provides a variety of modalities through a specialized team that includes nurses, mental health therapists, occupational therapists, speech and language, and assessment psychologists, on top of the physician supports that you've already probably known CASA for. The plan with children coming to this program is really goal-oriented so that children can thrive in their lives, and it includes both individual and group therapy. Any referrals for this program for children under the age of 3 can be completed by a family member or a health professional, and they are directly to CASA. For any of our children and youth that are coming ages 5 to 17, they are completed through Alberta Health Services centralized intake. And I've included the contact numbers and emails for each of the managers of all of our programs throughout our slide deck. Our next program area is specialty programs. So this includes our trauma program, family program, Indigenous mental health services, and our fast tracks or fetal alcohol spectrum disorder program. These programs really are focused on education and consultation and work with a lot of different providers. So family therapy is one of our programs underneath this area. It really supports families to improve their parent-child relationships and family functioning. The program really supports the child in a broad way, including the whole family, couples, parents, siblings and step-parents, grandparents, and anyone else that's really significant to that patient system. The program is meant for families who are really struggling with complicated dynamics and have at least one child under the age of 18 who's been diagnosed with a mental health disorder. The family team must be living, or the family of that child, as well as that child, must be living within the Edmonton area or within Northern Alberta to access this service. And referrals are made through, again, through a health professional, and they're submitted through Alberta Health Services through the centralized intake. And the manager for that program is Sharon Ling. The next program area under specialty services is our trauma program. And our trauma program is really focused on supporting the child caregiver relationship for those children that have experienced some significant trauma. It's really targeted at children ages 3 to 17 that have complex developmental trauma and or attachment issues. And they really are experiencing significant challenges in their daily routine and their function. Children of this referred to this program must have been in a stable home environment for at least 6 months prior to starting the program, because it is very intense. We have a couple of streams underneath this program. The first is our outpatient trauma clinic, where we support children ages 5 to 17 who have experienced the complex PTSD or developmental trauma. And the clinic supports those patients through individual as well as group didactic family therapy with the support of a psychiatrist as required. The second stream is what we call our TAG group, or TAG Trauma Attachment Group. And TAG provides a series of intensive treatment groups designed for severely traumatized children and their caregivers, which includes a weekly group and a mid-week phone check-in. Multidisciplinary team supports this, which includes therapists, psychiatry, what we call a therapy support navigator, as well as others as needed, nurses as well. Children's group and a teen group are both separated by their developmental age to support that particular population. And throughout the program, caregivers and various support individuals, could be teachers, caseworkers, extended family members, are encouraged to participate to build capacity to deliver a trauma-informed and attachment-focused care and learn ways to support caregiver burnout. Referrals for this program are made directly to CASA and are through a mental health therapist or psychiatrist, and they come into CASA, and again, our manager that's supporting that program is Sharon Lee. Our next program under specialty services is our Indigenous mental health program. And this is a program that is specifically to support Indigenous children, youth, and families from First Nations, Métis communities, as well as Inuit communities. Services are based on Indigenous cultures, worldviews, and spirituality. The team engages with families and communities, as well as other service providers, to deliver a holistic, Indigenous-informed mental health service. And so currently this team is growing. We currently have team available in the communities of Alexander, Alexis, Paul, and Enoch First Nations. And we're also providing services to other communities as required or as requested. We do provide some school-based programming that allows for further integration of these Indigenous approaches within the mental health service delivery that's occurring through the school. So the program can be referred to by caregivers, community members, agencies, mental health therapists, and or health providers. And it is done through our Indigenous Services Program Coordinator. I've listed the telephone number, and the manager contact is Mercy. And then our last specialty area is our Fast Tracks, or our Fetal Alcohol Spectrum Disorder program. This program is really focused on building the strengths of caregivers to meet their child's needs through developing skills. And this is specifically focused on children that have fetal alcohol spectrum disorder. CASA does not diagnose these children, but does provide the family with some support on how to get assessed, as well as the skill building. The caregivers learn skills related to practical management and parent-child interactions, and children learn how to have an opportunity to work on social skills through structured activities. The program lasts for 8 weeks, and the child attends once per week. And again, this can be referred to by a variety of community supports and or health providers through our Indigenous Services Program. The next area of our programming is our day and residential programs. And so the intent of our CASA Day programs and our residential program is really to improve the social learning skills of children and youth that have chronic or severe mental health challenges. The children and youth may also be struggling to attend or participate in school. So our day programs provide group, family, and individual therapy while also providing education in a small classroom setting within a controlled school environment. And CASA partners with Edmonton Public School Board to deliver school services over the course of a regular class school year. So our day programs specifically are broken into 3 categories: our preschool day program, our children's day program, and our adolescent day program. All of our day programs really focus on strengthening the abilities of our children and youth to develop new skills, whether it's interpersonal relationships and social skills, problem solving and conflict management. For all of our children, it's related to supporting their academic functioning, their emotional and sensory awareness, and organizational and family function. Care is provided through all of our day programs by a multidisciplinary team that includes, again, a psychiatrist, mental health therapist, teachers, speech and language services, occupational therapy, assessment psychologists, nurses, and more. So our preschool program is really focused on those children that are experiencing severe challenges managing their emotional behaviors. These children may also have difficulties in development, including executive functioning and or learning. And all of the children that come to our preschool day program are also PUF funded. So they would need to meet the criteria for PUF funding eligibility. For our children's day program and our adolescent program, they're really related to children who have had some assessment and some mental health support in the past, and it has not necessarily resulted in success, or the child is still not thriving in their life, whether that's school, family, or social. And the children have usually been struggling at some level with school. With both of our programs, there may have been some learning delays, or there may have actually been lack of attendance in school altogether. So referrals are made for our younger population, our preschool program, like many of our other preschool services, directly to CASA. And this can be made by a healthcare professional, but also we would like input from a school, daycare provider, anyone that's already kind of working with that preschool child and trying to help them move into the school setting. The children from this program also are required to have a physician, so that way we can ensure that once they've completed their program time with us, that they can move back to their regular provider. Children in the Children's Day program and the Adolescent program are also referrals can be made jointly by a healthcare professional as well as the school. And this really helps us to facilitate support for that child as they're transitioning to our day program, as well as when they transition back to their home school. Referrals for these programs are actually completed through the Alberta Health Services centralized intake. And again, these children are required to have a physician to help support them in that transition back to their care provider. And underneath each of these, we have Douglas is our manager for both the preschool and children's day program, and Sammy is the manager for our adolescent day program. Our last area in our day programs in residential is our CASA house. So CASA House is a voluntary residential program for youth grades 7 to 12, who have not experienced success in primary or secondary outpatient care. Youth usually stay at CASA House for an average of 4 months, and the program serves youth that have various needs, including severe mental health challenges, addictions issues, complex learning needs, family problems, as well as social issues, or a combination of all of those. Caregivers are active participants in the treatment and were required to attend family therapy and parent support group, as well as take their teens home on weekends, so that way they can practice the skills with those teens while they are still under the care of the CASA team. Families who live further than 2 hours away can have access to weekend supports every other weekend, so that way they're not commuting as frequently back and forth from CASA House. CASA House partners again with Edmonton Public School Board in order to deliver the school services, and this program actually delivers school services 12 months a year. The programming includes psychiatry services, therapeutic supports, including individual, group, and family therapy, transition services, and recreational programming. The big thing about this program is really the family component it provides, because it really tries to support the parent-child relationship and help the parent to understand effective parenting strategies and increase their understanding of their adolescent's diagnosis and knowledge of that adolescent's growth and development. Referrals are completed through Alberta Health Services centralized intake, and they come from a variety of areas, including Edmonton, North Zone, and East Central Zone. And as I mentioned previously, Sammy is the manager for both the adolescent day program as well as CASA House. Our assessment and treatment supports are really those supports that help our teams in our programs to determine diagnosis, develop diagnosis, and implement care treatment plans. The team includes our psychological assessment and consultation team, which includes our psychologists as well as assessment paraprofessionals. We have a rehab team that includes speech and language as well as occupational therapy. We have an addictions team that was historically known as our CAMP team, but we have now embedded the addictions counselors within programs across our organization to build the clinical competence in managing concurrent care. We also have a developmental pediatrician and a pediatric neurologist that provide consultation. And then lastly, we have an adult mental health team of psychiatrists that provide therapy specifically to parents of patients in order to support the progress of the families in moving forward. So we all understand that sometimes when children come to us, there are a lot of things happening in the family. So we do provide them with a short-term support of a psychiatrist for adult therapy. Our last area of programming currently is our consultative services. So this includes our professional development and education team, our Head Start and home visitation team, and our Indigenous wellness team. Our professional development and education team is a group of healthcare professionals, mostly mental health consultants, that work external to CASA and provide education, case consultation, and other sorts of supports to mental health therapists in Edmonton, North, and Central zones. We also have a team of individuals that go out to Head Start and home visitation and support the home visitation programs across the Edmonton area, really completing child observations, consultations, and then referrals to mental health services as appropriate. And then the last area that's really exciting for us and fairly new this year is our Indigenous Wellness Support Program. The Indigenous Wellness Support Program is really around supporting the professional practice of the therapy and consultative program teams in regards to supporting the Indigenous care of our children and youth as they come. The team includes elders as well as professionals that have worked in this area for some time, and they contribute to the care teams by providing cultural affirming care to clients who request it. They're also available to support those individuals that have been identified or request for Indigenous wellness as part of their treatment. The program supports the mental well-being by providing integrated biopsychosocial, spiritual, and cultural Indigenous informed approach to mental health assessment, treatment, consultation, and referral to community supports as required. So, future directions. And Andrea, you can pop in anytime if you want to add anything to our future directions. So CASA is pretty excited. We have some exciting things on the horizon. I'll talk to each of these areas briefly. The first is our CASA classrooms. So CASA has mentored, is partnering with Government of Alberta, community partners, and school divisions to deliver mental health classrooms. CASA classrooms, the intent is to address a need for services to be closer to students, bridging the child's mental health, school needs in a coordinated approach. Again, as Andrea mentioned before, we really want to go to where kids are. And we know that it's difficult sometimes for parents to be able to get their children to regular appointments for therapy. So we're hoping that by providing CASA classrooms closer to kids and being more accessible to where families can get to, which is sometimes only their local school, we can affect some change and be able to provide them the treatment that they need. The classrooms are designed for students grades 4 to 12 that have an existing mental health diagnosis. The intent is really to target those kids that have already attempted to some level of mental health treatment, could include medication, and have not responded and continue to have symptoms that impact their home, social, and school life. They need to be currently under the care of a physician, nurse practitioner, or psychiatrist, and be willing for the parent to be willing to participate in individual and family psychoeducational therapy. Students can come to the classroom from a geographical catchment area and must be referred from their school. The intent of this is so that way the student is supported by their school when they return again, once they complete their program time. The students will remain within the program for about half a school year, and then that's followed by another half a year of transition support for both the school team as well as the child and their family. Students receive individual and group therapy, psychiatric care, medication support, and school programming depending on their individual need. And this is provided by, again, a group of mental health professionals, as well as a psychiatrist, a specialized teacher, and support staff. While attending the program, as I mentioned before, the caregivers also participate in a Connections mental health educational program that helps them to understand their child's mental health illness, as well as how to support them. School staff are also supported in order to help them understand how to transition this child and integrate them back into a regular classroom. The first wave of CASA classrooms has kicked off in Sturgeon County, and we will be expanding that programming in Edmonton within the fall, as well as across the rest of Alberta by 2025. We're also working on better matching our children and youth to programs when they come to CASA. So we too are obviously starting to use the CalLocus. We're using the language in a lot of our community presentations and information, and now we're going to be using it as well in our admission and our transition work. We're looking at how to better triage and provide a diagnostic treatment assessment to improve our patients' readiness and program fit. As I mentioned before, some of our specialty programs are very complex. They have a lot of intensity. And so we want to ensure that the families are ready for that level of intensity so they can be successful once they've entered into that programming. And we're also looking at how to better establish community linkages and really provide that warm handoff to our children and youth as they move back into community after they've exited our services. We're also building some clinical pathways to really help better define how patients move through the system, both to CASA as well as to community providers and AHS. The pathway work that we're doing is really to help understand kind of the barriers and areas where there are maybe issues that impact children, youth, and families in accessing services, and then helping to guide them in a more effective way to the right service at the right time. We're also looking at expanding some of our services, as we mentioned before. So looking at how we can expand our virtual service offerings, expanding our programming to evenings and weekends, which would include, right now we've expanded our CASA house to have the second weekends availability for families, for patients to attend, but we're also going to be looking at other areas, in expanding our psychoeducational supports for families. So that way many of our parents are looking for this. And so we're hoping that we can provide this in a more timely way. We're also investigating the idea of having direct to psychiatry referrals for CanReach trained physicians and others, as well as nurse practitioners, and additional day and residential sites across Alberta by 2027. And here's our contact information, both for myself and Dr. Yu, as well as you can go to the CASA website for more information about our programs and services. And we will pause for questions.
Actually, before questions, I think we just, oh, by the way, I want to say that thank you very much for your very enlightening and whirlwind presentation. I'm looking at the time. We are well within a time, so I don't see any questions in the Q&A yet, but I can provide a couple of messages while we wait for a couple for questions to come in. So just a reminder that these rounds are accredited by the Royal College of Physicians and Surgeons of Alberta and the College of Family Physicians for live attendance, and that for the Royal College, these rounds are a self-approved group learning activity under Section 1 for up to 1.25 hours. And for the College of Family Physicians, this presentation has been certified for up to 1.25 Main Pro Plus credits. And I also want to remind people that our April rounds is hosting an international speaker, and so it's going to be at a different time than usual. It will occur on Wednesday, April 12th at 4 p.m. our time. Registration for this session is the same, and Dr. Kasia Kozlowska will be speaking about functional neurological disorder from the University of Sydney from Australia. So we had to change things a bit to accommodate time zones, etc. And so okay, so before I go to the okay, so actually we have one question. So thank you for the helpful overview. Are there currently any mechanisms in place to ensure that patients and families are being referred to the best program? For example, a day program instead of CASA House, or a day program instead of a Glen Rose admission, etc.
Dena, do you want me to start?
Sure.
So I think, thank you, Dr. Morissette. I think recognizing that that is a challenge, that is exactly why when we look at our future directions, what we're doing is actually ensuring that internally, and as we're working with our AHS partners and our community partners in general, we are clarifying when somebody is actually entering our programs, that we are actually matching people to the best place at their best time and the right fit. So I know, for example, when Dena mentioned like our intensive programs, we want to make sure the families actually know and recognize the work that they're going into and making sure it's the right fit. So in terms of the actual mechanism currently, I would say we're aware of it. It's a process in place. Within each of our programs, there is a bit of an assessment process to ensure that, okay, so have you done A, B, and C? Is this the right fit? Before you come to our trauma team, is this a better fit for core? Because have you done some of the foundational work before we do some of those very intensive trauma type work? So it's a bit more internalized within our organization right now. And certainly there's a lot of work that I think still needs to be done, which is why it is part of our kind of future directions. Dena, did you want to add to that?
No, I don't think so. I think you've covered it all. Yeah.
Okay, so moving on from Dr. Matthew Marisette to Dr. Lindy Van Riper's question. I noticed that some services aren't through intake. What differentiates the services not through intake versus those that are?
So that's a good question. And actually, you'll notice, Dr. Van Riper, most of our direct to CASA referrals are actually for preschoolers. So at this point, there is no central intake for preschool-based services across the whole zone. I know that we're working with our partners over at AHS to look at ways that we can better move the preschoolers, just like we are working with AHS on the central, those that do come through us through central intake, but it mostly is our preschool program. The other area would be our trauma clinic. And again, trauma clinic kind of grew out of the need to kind of better differentiate again, some of those kids that were coming and what were their needs and were they ready to be able to move into the intensity of the TAG program. So we are looking at how we can better streamline some of that through our pathway work. So we will hopefully have more information that we can communicate out to our referral sources, as well as we're going to be working with our AHS partners to develop out some of that pathway work and be able to really clearly define, go this way or go that way. But I don't think it's always clear, kind of to the Dr. Morissette's kind of comment. Sometimes it's not always clear until you start to see the kids and you start to get them working with them as to which is the actual perfect place, but we will try to do our best to really help differentiate them a little bit earlier and a little bit in a little bit of a different way than we've done in the past.
Sorry, for trauma clinic, we just wanted to clarify. So are there other pathways?
So a trauma clinic itself can, a family can refer, and in like a family or a mental health provider can refer, but in order to get into TAG, the TAG group work, so they're kind of in two different streams, we have to kind of reconnect with our AHS central intake and kind of do a few things there. But a lot of the time, most of our patients come to our trauma program through AHS. There is a way though for families to connect with us directly, or providers to connect with us directly.
So talking about direct referrals, because families can self-refer to regional intake, and I guess the corollary of that is it then possible for them, for example, if let's say they are familiar with CASA programs, or let's say check out your website, they're like, that could be a helpful program for my kid. Could the parents then contact regional intake to request that, hey, can my kid attend this CASA program as long as they're in the Edmonton and area region?
So at the central intake, all of our programs are listed there, and they're also scored on the level of Cal Locus. So in order to ensure that we have the right kids coming to the right program at the right time. And so the intake therapists are able to assign CASA programs as a family, say, comes in and contacts them and goes through the intake process. They are able to request CASA, but again, it would have to be related to the right Cal Locus score. And the program really does need to meet the needs of that child. Historically, we've had some referrals for children to come to us for, say, speech and language supports. And really, our speech and language supports for CASA are for CASA patients while they're in programming, so we don't have to reach out and try to organize and coordinate that. But for the most part, we're working really, really closely with our intake team at AHS Central Access in order to ensure that they know what our programs are offering, they know how to move patients to us. We are connecting with them on a frequent basis around those patients that are getting referred to see if we are the right fit for that patient at that time for that particular need.
Yeah, so it needs our Cal Locus informed with information provided by the family, but outside of that, it sounds like family preference that would be taken into consideration as well. If let's say they want CASA versus let's say another service.
Correct.
So I don't see any other questions in the Q&A. I know this was a really, quick overview, that you had provided So in terms of some of these consultations services supports, I guess I do have a question about the, I guess the renamed and revamped professional development and education team. So that used to be CGT, right? Community Geographic Team.
Yes.
So is that team now working somewhat differently than previous, or aside from the name change, are there other changes?
No, not really. Actually, if anything, pre-COVID resources had the resourcing of the team had definitely gone down. And so we're actually currently recruiting additional mental health consultants to continue the work that they were doing as the CGT team. The rebranding and retitling, I think, just aligns nicely with the work that they do. But we are really hoping that we can start to, again, engage both in a virtual way as well as in person to the communities that we're working with up in the Northern Alberta and central zones. And we're also, the other brand change or the name change for CGT to Professional Development and Education was really also because we're going to be doing more work both in Edmonton area, internal to CASA, as well as hopefully connecting more with our AHS partners across the community-based services.
Dr. Leung, I mean, if we're waiting for questions, I think some of the things that I want to just emphasize is that a lot of this information shouldn't be so brand spanking new for everybody here, attending our grand rounds. So much of what we've been focusing on in the last 2 years is to make sure that our programs within are robust, like well-staffed, well-educated, functioning well, and then internally making sure that we have the appropriate linkages, again, to Dr. Morshead's point, to make sure that we're making sure that we're serving people in like the right timely manner, and that we are optimizing like what we need to do so that we're a sustainable program. And part of that is making sure that with our foundations, once we have that well established and we like what we're doing, however, we know that there are better ways and better ifs and improvements that we can make. It is using that foundational work to look at how we expand and how we reach. And that's a little bit of that further future directions. So it is internally making sure we've got good linkages, externally making sure that we're partnering with people so that we have those consistent linkages, clarifying things when it comes to referrals, clarifying how we're transitioning people internally as well as externally. And again, recognizing that the system at large has all of these needs. And so even when we talk about the classroom work, that is modeled after our CDP, after our ADP type programming, and it is very much using what we know best from what we do internally and mapping that on to other opportunities. Similarly, I think many might be familiar with the government announcement where we're looking at how do we expand our services to other vulnerable spaces, including rural spaces. And again, looking at what we do internally and partnering so that we can actually help elevate and escalate the services that maybe other partners in other locations bring. And so I know when Dena talks about kind of our specialty programs, we're making sure that they're finessed and well. Like we know family therapy is a high need across our zone and just in general. So how do we do it internally? How do we map out, again, externally? And again, it's very much looking at where the needs are, where we hear from our stakeholders. Like we know a direct to psychiatry pathway is going to be a critical component. So it is going to be, how do we build that in a sustainable fashion with our current organization learnings and optimization so that we can continue to grow and expand in a very sustainable and deliberate fashion.
So we do have a question from Dr. Van Riper with her educational coordinator hat on. May we please put your presentation onto the resident drive?
Absolutely.
All right, and we have another question from one of our eating disorders specialists, Dr. Michelle Foster. I wonder if you could speak to the wait list for various aspects of programming. Your services are so valuable and high need.
So, Andrea, did you want me to?
Yeah, go for it.
Okay, so we are working on how we manage our wait list and how we manage our patients that are waiting for service before they get to CASA. So a few of our programs, again, we were not immune to the staffing challenges that have occurred in various areas across the health sector over COVID and post-COVID. And so some of our wait times have actually been attributed to a significant movement of individuals into private practice in other areas. So we've done a pretty robust job now of staffing back up our programs and services, so that way we can ensure that we have an ongoing workforce to support these families, because we understand that moving from a CalLocus level 1, many of our services at the, historically had a CalLocus level 1 that could be attributed to them, to a level 3 means that we're going to have kids for longer. They're not going to be easily moved back into primary care or other resources and support. So we're going to need to be able to maintain them longer. And the skill set of the clinicians that are also supporting them needs to increase in order to meet and match the requirements. So in our day programs, we have a wait time. Our window of our referrals kind of usually is prior to the start of the day program cycle. So I'm going to talk about the day programs in CASA House. Our day programs, it kind of depends on the cycle. Coming into the classrooms, most of our day programs will start in September. And then for our child and adolescent day programs, we will open up referrals again here starting in May for the next September cohort, or usually in November, December for the February cohorts. CASA House is a revolving wait list, and we do have beds that are allocated specifically to the northern and central Alberta regions. So those tend to be a longer wait list sometimes than our Edmonton urban, because there are so many kids in those communities that have very few other accesses. So again, how we can support that going forward, we'll be looking at, but really the day programs in CASA House are fairly static in their wait times because we have a very focused and specific time for treatment. And when it comes to our other programs like our family therapy, trauma program, core program, Indigenous services, those are all kind of evolving. Again, as I mentioned, by the workforce development, we're really working on how do we ensure that the families and the patients are ready to move into a program like trauma that has a fairly lengthy wait time, but also a very intensive extended treatment period. So we are trying to look at some of the ways that we actually differentiate kids into programming a little bit differently, as Andrea already mentioned, how we actually look at them, not only from a CalLocus perspective, but kind of as a global kind of approach, and be able to move them into treatment. We are also looking at expanding the offerings of group therapy in a variety of our programming areas, and then how we utilize our physician resources. So that way we can ensure that our psychiatrists who really help us around that differentiation are utilized in a very early and timely way to help really build out a more specific and focused treatment plan to be able to move kids through to the programs that they really need to get to. I hope that answered your question.
I suspect Dr. Foster is hoping for specific numbers in terms of like specific months.
Which I don't have on hand today. I'm so sorry, but I can ensure that we can communicate something out to the group if that's something that they're interested in.
So, thank you. I do have a question about the expanded and I guess integrated Indigenous, services, which are really exciting. So can you maybe help us understand the difference between the Indigenous mental health specialty service and the Indigenous wellness, consultation service? Because if I'm like, let's say I'm someone, or if I have a family who, wants a more enhanced Indigenous experience and support, then what's the added value, I guess, of, let's say, coming to CASA?
So the Indigenous programming that's occurring out in community is really focused on working within that community environment and really working with the schools within that community, as well as all the partners. So that's kind of the one program area. The other, related to the Indigenous wellness program, is really supporting providers to understand and integrate Indigenous approaches to treatment, and being able to walk alongside a therapist in the service delivery. So whatever modalities they're using, being able to add on those additional Indigenous based treatment supports, or ways of supporting, or ways of caring, and do it together in a collaborative way. I think the benefit is really that we have had some team members available in some capacity over the last several years, but this is really becoming a more robust team that can go out and be part of a treatment session can be part of a care team versus more focused on a consultation model and then stepping away and referring to services. I believe the intent is really to be there and to be present in the treatment of those children and youth. Andrea, did you want to add anything?
No, I think just in simplistic ways, Dr. Liang, one is more direct contact for patients and families, and the other one is to upskill and support a mental health practitioner so that they're still the primary individual in that second case, but they have that the additional Indigenous supports. So to actually be able to appreciate from a different lens, from a different perspective, but they can still provide that ongoing care. And again, for specifically when we're working with families and patients, that's where it is directly in particular communities. And again, in that particular one-to-one, almost like that hands-on, providing that direct treatment capacity.
And are the consultation services currently just for within, CASA clinicians, or are you thinking of it, providing this support for outside CASA clinicians?
Yeah, I think originally, currently, as our team is growing, it will be internal, but it will be, the intent is to be external as well, to provide more support to other providers and other clinicians across the geographical area, specifically, I think, focused for now on the Edmonton area, and then expansion as other programs roll out.
And then for the Indigenous mental health services, it sounds like you are providing a direct service, but you're not preempting the service they're already having, but it's more adding the Indigenous aspect, even if it is a direct service, onto whatever service the child or adolescent or family is receiving already. Not that it's going to take over. Let's say if I want a therapist who has more of that Indigenous background, like it's not like we can refer a kid to that, but it's an enhancement of the service they're already having. Is that correct? I'm seeing Dena nods.
Yeah.
Okay.
Yeah.
All right.
Yeah.
Okay, so I think Dr. Michael Levinsky, who is our medical lead for the preschool day program and the children's day program, he's indicating that the current wait list is very short and that they're accepting referrals for September of this year. So I guess that's an invitation to refer your kids if they're suitable and within the age range.
Thank you, Dr. Levinsky. Yes, as I mentioned, the opening up now for referrals at the perfect time for the team to be able to start to meet with families and have a conversation about the program, and be able to get them ready and prepared to participate in September. April is the month. April and November. If you want, if you have children that are looking to get into this Children's Day program, April and November are your months, and for preschool, it is April for the September start.
I'll put a plug for Teen Tag. This is also a good time, partly again, because then they can do some of the foundational work before and then doing that assessments, because Teen Tag starts from September until May.
Okay, I'm not seeing further questions, so we're almost at the top of the hour. And so I do want to remind people to fill out the evaluation. So there is the QR code that you can scan, or you can go through the link. And just to let people know, the Child and Adolescent Psychiatry Grand Rounds Committee does look at all the evaluations, and we do take into consideration people's suggestions for topics and speakers, and feedback, positive or negative. We appreciate it all. So yeah, I don't see any further questions still. So I just want to thank you very much, Dr. Andrea Yu and Dena Pedersen, for your passionate care of children and youth and families through CASA. And yeah, because I think many of us have heard about CASA in the news, and some of us who are maybe not, as intimately connected to CASA are wondering, hey, what's going on? So this has been really a helpful overview of, where CASA, what CASA has been working on, and then some future directions that CASA is moving toward as well. So this has been really helpful.
Thank you for having us. If there's ever any questions, please feel free to reach out to either of us. I say that, as many of you know, I'm going on maternity leave, but feel free to send me any questions or messages anyway.
You just have a lot of emails when you return.
All good.
It's like questions from the past year.
Things might evolve a lot in a span of a year. We anticipate that it might, but always happy to, answer any questions or to be supportive and helpful in any way we can.
Okay.
Okay.
That noon will end. Okay. Thank you.
Thank you.